Hello, I'm Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years clinical experience. And today's question is, could I have an ectopic pregnancy? And the short answer is yes. But let's get some more information, some background to give you some context. So the take-home message right from the start is, if you're entertaining that thought, that's when you should be getting in touch with your provider and seeking some help. With that being said, thankfully, ectopic pregnancies are still pretty rare. And worldwide, they're one of the leading causes of death for women in the first trimester of pregnancy, so they are to be taken seriously, but thankfully that doesn't happen too often in the United States or in places where there's good access to care and good access to information. So let's go over some of the risk factors. Let's talk a little bit about what an ectopic pregnancy is and try to give you a little bit more information so you know what you need to do if you have this concern. First of all, an ectopic pregnancy is a pregnancy that is not inside the uterus. It can be in multiple locations, but we're going to focus in on it being in the tube. So it can be in the tubes, it can just be floating in the pelvis, it can be in the ovary, it can be in the cervix, it can be other areas. Those are much less common, but the most common place to be is in the tubes. And unfortunately, this will not result in a baby. As the pregnancy starts to develop, the tube is small and restricted, and it can accommodate the rapid growth of a pregnancy, and that can cause bleeding and rupture, and that's when it becomes life-threatening for you to be bleeding internally. So what are some of the risk factors? Well, anything that might damage your tube. So any scarring or adhesions that might result from, for example, STDs. So gonorrhea, chlamydia are the most common to cause to increase the risk of pelvic adhesions, or pelvic inflammatory disease that can result from those infections or others that increases your risk of having a pregnancy in your tubes. Also, having a prior ectopic pregnancy increases the chances that the next one will be also an ectopic pregnancy. Or if you had any damage intra-abdominal or surgery intra-abdominally, like if you had appendicitis, especially a ruptured appendix, or if you had a C-section before, or if you had your gallbladder removed, those slightly can increase the risk. Or if you have chronic pelvic pain or pelvic adhesions, perhaps endometriosis. Some of these topics are covered in my other videos, but if you have any problem that could potentially have irritated or damaged your tubes, that can interfere with the egg being released from the ovary and caught with the fimbria, the little fingers of the tube, and flowing in through the tube, getting fertilized in the tube, and ending up inside the uterus. Okay? The risk increases a little bit with age. It increases with multiple sexual partners, meaning higher chance that you've been exposed to an infection that damages the tubes. It's also a higher risk if you have infertility issues, or if you're undergoing infertility treatments like in vitro fertilization, IVF, or intrauterine insemination, IUI, and others. So those are some of the risk factors. Generally, ectopic pregnancies happen around 6 weeks pregnant early on, and they generally have a little bit of bleeding, irregular bleeding, but yet generally not a lot of heavy bleeding, and they can present with pain. So those are some of the symptoms to watch out for. It's important for you, if you're thinking you're having some bleeding issues, you're having some pain issues, that's the time to contact your provider to discuss with them. What will they do? They might do some blood tests to follow your hormone levels, a quantitative HCG. They might do also a serum progesterone as another hormone level. They might do some ultrasounds. It might take some time to make the diagnosis. The important thing is to get in touch with your provider. Also remember that half of all pregnancies have some kind of spotting or bleeding in the first trimester. You can see my other video on first trimester bleeding. So that doesn't necessarily mean you have the ectopic, but if you have a lot of those risk factors and you're having some bleeding and some pain, certainly get help sooner than later to avoid any serious potential consequences. I hope you found this information of use. Please leave your comment. Thank you.